Well, thank you everyone for joining us on our hyperbaric oxygen therapy webinar, and thank you, Dr. Murphy, for joining us as well and agreeing to educate us on the benefits of hyperbaric as well as the history and a little bit more about the comparisons of different chamber types and much more that we'll get into. Just briefly, I'll go through the goals of the webinar, the brief agenda, and then I'll introduce our speaker, Dr. Murphy. So the goals of the webinar are frankly just educational. We want to ensure that all the attendees get a good understanding of really the history of hyperbaric, what it's been used for over time, how research has evolved, which we'll really get into, and how it continues to evolve, what the FDA has approved as current on-label uses for hyperbaric, and really the growing and emerging body of research towards additional benefits that are frankly pretty impressive and impactful to society. So we really hope to cover the main topics on future webinars. We'll go really deep on some other subjects and conditions as well. This is meant to be more of the summary of hyperbaric. Where have we been? Where are we going? So we'll go through the basic understanding of hyperbaric oxygen therapy, what some of the benefits are, the mechanisms, how it's evolved over time, the uses and benefits. And then at the end, we'll have a Q&A section. All the attendees are muted, but they can raise their hand or they can submit a question through the Q&A chat, and we can respond to those as we get to the end. With that, I'll introduce our speaker, Dr. Stephen Murphy. So Dr. Murphy is a board-certified physician in internal medicine. He's also a UHMS certified hyperbaric physician. He's had nearly 20 years of experience in internal medicine, obesity medicine, regenerative medicine, genetics. He's studied quite a bit. He's quite the scholar as well. Certainly in conversation, he will take you deep into a topic with his breadth of knowledge. Through his practice, concierge medical associates, he focuses on treating patients with a comprehensive approach through the curation of personalized treatment plans for his patients. He's also a partner and medical director for MD Hyperbaric Stanford, and he has great passion for the benefits of hyperbaric oxygen therapy, which I'm sure will be clear as we go through the presentation. He's been a pioneer in many fields of medicine, including genomics over the last decade, and he's done quite a bit of research and been a pioneer on the clinical front and helped thousands and thousands of lives. So I'm very honored to have him on the webinar and as a partner in MD Hyperbaric. So with that, I will turn it over to you, Dr. Murphy.
Chris, thank you so much. And thank you to everybody that's on today. This is quite a response. I'm really excited. Right? There's patients, there's colleagues, there's contemporaries and peers. Just a little bit, and I appreciate it, Chris. So what I am is I'm a regenerative medicine and longevity doctor. And so what I do is I seek out the best technologies, tools, medicines, and treatments to help you heal yourself, to help you regenerate your body, to help live really what I call a life well lived. And one of those fantastic tools is hyperbaric oxygen therapy. Now, hyperbaric oxygen therapy traditionally has been thought of just for people that have problems with their non-healing wounds. I can tell you in the medical field, a lot of time, most people hear hyperbaric oxygen and they think actually someone who's very sick, someone who has diabetes, who may be a smoker, or who may have blood vessel problems. But hyperbaric is not just for them. So we're going to go over that today. We're going to talk about all of the amazing literature that continues to grow and on the future of medicine and how hyperbaric oxygen is really a fantastic tool to help you stay young. So first I want to go through what is hyperbaric oxygen. Well, for the doctors on here, bear with me, tough luck. You're going to have to hear this. For the patients, I'm sure they've heard some of this before. And for everyone else who's interested, bear with me. You may know these terms, you may not. I want to make sure that we really understand what's going on. So hyperbaric really means, put simply, hyper, and like ADHD, right? More energy than you have. And in this case, hyper means increased. And baric is simple. It's like the barometer. It's like hyper your barometric pressure. It is pressure, and that's what baro means. So hyperbaric means increased pressure, and this increased pressure allows us to push oxygen into areas of your body, creating a wonderful response that you traditionally could never get on your own, even if you have oxygen yourself. So if you look at the physics of oxygen and pressure, during normal breathing, our red cells carry our oxygen throughout our body. That is why blood vessels are so very important. They carry these red blood cells. Now, as we drift along through our blood vessels, these red blood cells drop off oxygen as they go. And as they continue to go further and further down the chain of our body, they lose more and more oxygen. As we extend to the tips of our fingers or to our toes, we have less oxygen than we do in the center of our body or in our brain. And that can be a problem when you're trying to heal a ACL or a meniscus or an ankle tear or even carpal tunnel. And so we'll talk a little bit about that. What's amazing is that the pressurization allows us to dissolve more oxygen in our bloodstream, therefore allowing us to push more oxygen into our extremities, into our brain, into our kidneys, into our heart. And we'll learn why that's important a little bit later on in this lecture. Now, there are two pressure laws that I think are really important here. The first is Boyle's law, and this is very important when you're selecting a hyperbaric chamber and you're selecting a hyperbaric provider, a physician who's going to give you the best care. And I say physician because if you do hyperbaric oxygen at a place that doesn't involve a physician, you could have some really bad adverse effects. And one of the reasons for that is called Boyle's law. And as you go down in the chamber, it doesn't hurt you so much. But as you leave the chamber and come back to normal pressure, you can have some very adverse effects if you're not monitored medically. In addition to that, Henry's law, which tells us that each of our gases has a proportional absorption in our bloodstream relative to the pressure. And that's very important when you're in your chamber, which is just air by itself. You can dissolve a lot of nitrogen in your blood. And that is what we call the bends, coming up from a pressurized chamber too quickly with too much nitrogen in your system. And we'll see there are some med spas and places where you can buy your own chambers that could put you in a very bad situation if you don't have 100% oxygen. So the next thing I want you to think about, and we'll talk about it right now, is just what I said. Normal breathing versus what we call a traditional hard chamber, or what happens when you go to the ER and they put you on oxygen. And so each of those different levels allows us to distribute more oxygen to our body. Now, a traditional breath, we can deliver around 157 millimeters of oxygen in our cells. So that is what I want you to remember. At breathing normal, 1 atmosphere, sea level, you can get 157 millimeters of oxygen. Now, what happens when you go up in the mountains, you get less oxygen. And we know that training with less oxygen allows you to adapt physiologically. Hence, we have runners from training in the mountains in Africa come and will go down in the Boston Marathon or in New York and kill it. That's because they get more oxygen at sea level. Now, what happens is we increase the pressure in a traditional soft chamber, or one of the chambers you could get at a home or a med spa, you will get 237 millimeters of mercury. So it increases oxygen, but not nearly as much. Well, what happens when the ambulance comes to your house and you get oxygen? Well, they can give you even more oxygen. But again, it's only around 400 millimeters of mercury from the oxygen you could get from your ER, the paramedic, and the ambulance. Now, with hyperbaric oxygen, we get much more oxygen than that. And at certain atmospheres, even at 3 atmospheres, we can get over 2,000 millimeters of mercury in our cells. So millimeters of mercury is a measurement of pressure that's dissolved, of the partial pressure of the gas in our bloodstream. that goes to our cells. And so as you can see, from normal breaths at 157 to up to 2,000 millimeters in a simple 2-atmosphere treatment, which is one of our standard treatments, you get around 1,300 millimeters of mercury. Now, that's great and all, but how does that work? It's great. You gave me a lot of oxygen. What am I going to do with it? Well, it's not like you won the lottery and you're going to go spend it and end up losing everything that you have, as we've seen in a lot of lottery winners. Instead, what we do with that oxygen is amazing. The pressure that we receive and the oxygen that we receive allow our wounds to heal. They allow our tendons to repair. They allow for remodeling. And actually, they also allow for new blood vessels to grow in. Why is that important? Many of the problems that we have, whether it's in our brain or whether it's in our joints or whether it's in our tendons or our muscles or even our nerves, is that we don't get enough blood. And so by promoting new blood vessel growth, we can deliver more oxygen and allow our bodies to heal and regenerate. And that, in the essence, is regenerative medicine. Some of the key benefits, again, are not just the new blood vessel growth and not just your improved oxygen, but we found some more amazing things, especially over the last 5 to 10 years. So we'll see that hyperbaric oxygen has been around for well north of a century. And in fact, the earliest, most rudimentary stuff we'll talk about was around in the 1600s. So what we've found over the last 5 to 10 years, because our ability of scientifically to detect these subtle changes in our cells, are the following. We have found that hyperbaric oxygen improves stem cell release. What are stem cells? These are cells that have the capacity to turn into other cell types. In addition to that, they secrete these little molecules called exosomes that tell the rest of our body what to do and how to heal. Now, there are good exosomes and there are bad exosomes. The exosomes from our stem cells are traditionally very good exosomes. In addition to this, we've found that your mitochondria, the little powerhouses in each of our cells that help turn cells on and make them active and give them the power to heal, well, they get healed. They get healed by hyperbaric oxygen. Our own mitochondria, our own renewable energy source, can heal itself in the face of hyperbaric oxygen. In addition to that, problems like arthritis, rheumatoid arthritis, multiple sclerosis, inflammatory conditions, their inflammation is reduced in the face of hyperbaric oxygen. In addition, there's some really amazing things relative to our immune system and hyperbaric oxygen. One of the biggest problems we've seen with people who have COVID or in people who age is that their immune system cannot respond properly to a challenge. And instead, they end up with chronic inflammation and significant problems of aging. Hyperbaric oxygen has been shown in studies to improve your immune system response. And it has also been proven to wake up your immune system so it can fight off infections better. In addition to these things, one of the hallmarks of aging is a messed up microbiome. Our gut bacteria, they're insulted every day. When we get antibiotics, when we eat seed oils, when we go for fast food, and I know some of you go for fast food. I've seen you on here. I know it. And so what happens is that destroys good bacteria in our gut. With hyperbaric oxygen, we've seen restorations of better populations of bacteria in our intestines, resulting in a better outcome, less inflammatory bowel disease, less irritable bowel syndrome. And lastly, many of you know that I take care of several professional athletes in lots of sports. And I can tell you one of their mainstays of healing whenever they're injured is hyperbaric oxygen. So I want to talk now a little bit about the evolution of hyperbaric oxygen. How did we get here? And why do most people think that the hyperbaric oxygen that is in hospitals getting wound care is the only hyperbaric oxygen there is? So let's start a little bit going in the Wayback Machine, Dudley, to the 1600s, and where we saw the initial concept of using pressure for therapeutic purposes. And in fact, we find history reports of the first hyperbaric chamber called the domicilium, and that was published in 1662. And yes, there were doctors back then, and there were physicists, and they were actually far more related to each other than nowadays. As we see this progression from the 1600s, we look at the 1800s. And in the 1800s, pressure for pulmonary disease was widely investigated. And in fact, you can look at Paul Burt, who was able to understand the modern risks and benefits of oxygen therapy. And really, this laid the groundwork for the next almost 200 years now. The 200 years of hyperbaric oxygen therapy. That's right. I'm going to say it again. Hyperbaric oxygen therapy has had a history of 200 years of use, investigation, and study, making it probably one of the most well understood mechanisms of healing in the world. And so in the early 1900s, we saw a lot of hyperbaric oxygen used in the world wars. This was used for deep sea divers, and this was used for pilots. And in fact, one of the things in the late 1900s, 1970s, we saw an explosion when the Air Force developed their own hyperbaric oxygen systems. Traditionally, a mainstay in the US Navy, I know myself, I was a midshipman, was the United States Navy diving charts. And hyperbaric oxygen was used for divers all over the world. And so we have a lot of military study on this, and we've discovered how to treat decompression sickness, gas air emboli. And in fact, during the world wars, we introduced hyperbaric oxygen for treating gangrene of wounds and carbon monoxide poisoning. So you can imagine these were big things for soldiers, and it was a remarkable foothold and massive advance that we saw. And as I said before, in the 70s up until the 90s, we start to see traction of non-healing wounds. And this is where one might think hyperbaric oxygen was only for healing wounds and infections. Nothing could be further from the truth. In the 2000s, and especially in the 2020s and the late 2010s, we've seen a revolution in hyperbaric oxygen. There are teams in Israel and the Middle East, there are teams in Europe, and there are teams in America researching hyperbaric oxygen for longevity, for healing your telomeres, for improving your stem cells, and for staying younger longer. We're going to talk about that today. So with a device just as this, you can imagine, okay, this sounds like the Wild West. And you're right. It was the Wild West. And in fact, there are still some people who are using soft chambers as the Wild West today. Well, as you can imagine, you are pressurizing someone with oxygen. Pressurizing with oxygen. Okay. That to me sounds like something that should be regulated, right? Yes. Like a pressure cooker, there could be adverse events. And it is best to make sure that the chambers that you have and are creating are approved by the FDA. Well, I'll tell you right now, the FDA does not regulate the practice of medicine, but it does regulate what you put in your body through eating or through IV, or the devices used to deliver those medicines. And hyperbaric oxygen chambers are devices to deliver medicine, which is hyperbaric pressure and oxygen. So as you can imagine, before the FDA was really around, hyperbaric oxygen was used for whatever it could be. There was a lot of therapy out there, whether some of it was effective or not, wasn't studied very well. The only people that had the great studies were actually in the military, and they produced a significant amount of the data that we see today. In the early 70s, the FDA had finally recognized that hyperbaric oxygen was a legitimate medical treatment, predominantly because of the studies that were done in the military. And these studies were fantastic. And so we began to see the growth of hyperbaric oxygen in hospitals. In the 80s and the 90s, we expanded the approved indications. And in fact, one of the biggest problems we see today is that Medicare, which is really the rate limiting step for approval and payment of these, the Medicare had a very restricted amount of on-label uses for hyperbaric oxygen. So much so that another payer, TRICARE, which pays for the military and their benefits, had to expand their own approved uses to include traumatic brain injury. Can you imagine that? Traumatic brain injury is effectively treated with hyperbaric oxygen, and Medicare won't pay for it. Instead, the military had to lobby to get their insurance, TRICARE, to pay for it. And so it's important to understand the difference between on-label and off-label uses. And we'll talk about that in a little bit. But in recent years, really, there's been a rise in at-home chambers, celebrity chambers. I can remember myself in the National Enquirer when there's a big picture of a chamber with Michael Jackson in it. I don't know if anyone remembers that, but it said Michael Jackson is going to live to 150 in a hyperbaric chamber. And I can tell you the following. He might have if he hadn't been getting injections of propofol for sleep, okay? He might have lived that long because hyperbaric oxygen helps with our stem cells and healing genetically. But there is a danger. If these chambers are not regulated and monitored with the appropriate medical care, then you can have some pretty big problems. And we've seen the FDA issue a massive amount of warnings about non-regulated chambers. These are chambers that you can buy on eBay, that can be imported, that are called steel tube or steel drum, and they're shipped into the United States and they're not regulated. These could show up in a Medi-Spa near you. They could say, we have a hard chamber. Well, where did you get it from? Was it FDA approved? What's your device? In addition, we see mountain sickness bags, also known as portable hyperbaric chambers that people are selling online, Amazon, eBay, wherever, that also do not have FDA approval. And so there is real risk there. But before we talk about the risk, I really want to talk about the benefits of using a proper hyperbaric chamber. Now, we've talked about the chamber, and you may have heard me talk about the term soft chamber. Well, soft shells are pressurized with air predominantly, and they deliver oxygen via a mask. These soft chambers can never really achieve the pressure that you really need to be able to achieve maximum benefit. Now, to achieve maximum benefit, you need what is called a hard shell. These hard shells can either be monoplace, meaning one patient, or multiplace. As you can see here in the slide, there are a lot of space cadets here with helmets on, and these helmets are filled with oxygen. Now, you may ask, wait a second, if you fill the chamber with oxygen, why do they have to wear helmets? Well, the military figured out that if you fill a big multiplace chamber with oxygen, there is a risk of a fire. And frankly, you don't want a fire. Yes, this is another reason why it's important to have the proper safety protocols in place and the proper training. I do not want my esthetician giving me hyperbaric oxygen. I just admitted I may have an esthetician, but I do not want them dialing up, bringing me down in a chamber and watching for safety protocols. And so because of that, the FDA and the United States Navy and the Air Force have decided that the best way to deliver oxygen in a chamber filled with people is through what we call a hood. And these are hoods that sit over your neck as if you're going to space. You can pretend you're on Gattaca or Buck Rogers taking off into outer space. And in fact, these hoods are a very effective way to deliver oxygen in a chamber that is multiplace, meaning with multiple people. So let's talk a little bit about the chamber comparisons. And this is something that I think is really important. And there is a term now called mild hyperbaric. And I don't know where this term came from. I really don't understand it. I think it was done to skirt around the laws and regulations that are there for safety. And mild hyperbaric is what we call soft chambers. Now, these are chambers that can deliver only 1.3 atmospheres of pressure. So they don't really get too much to therapeutic ranges. And in fact, for most studies with hyperbaric, they use measurements under 1.3 atmospheres. Why? Because traditionally we thought not much goes on in a soft chamber that way. And predominantly that's the case. And in fact, there's very little therapeutic data on a soft chamber. That's number one. Number two, soft chambers can still be dangerous. They can give you nitrogen poisoning, especially if you're breathing air in a soft chamber and you get depressurized quickly. You can get the bends, and we've seen that. And so there are risks with using a soft place chamber without proper monitoring. And on top of that, you really don't get a lot of the benefits. So I have to ask, why would you want to take the risk with a soft place chamber if you're not going to get the benefits that are expected in a true hyperbaric situation? What do I mean by true hyperbaric? These are hard chambers that can rise their pressures above 3 atmospheres. All right. So these are chambers that can give a delivery of pressurized oxygen using 100% oxygen in a safe space to affect the changes that I just told you were amazing benefits of hyperbaric oxygen. In addition to that, most of the research has been done on hard chambers. These are FDA approved. These are the American Society of Mechanical Engineer certified and compliant. These are tested for their pressure. So you can imagine when you pressurize something, it could pop apart. So wouldn't you want to test it before you use it? Yeah, even my Instapot, I like to test before I use. And in this case, if you're using a soft chamber, you're placing yourself at risk of harm. And why risk that? So now that you know a little bit more about the benefits of hard chambers and the benefits of hyperbaric oxygen, I want to go through the FDA-approved indications, which are our traditional FDA-approved indications. And then I want to talk a little bit about off-label indications. Now, when I think FDA indications, I think either Turks and Caicos or a diving in the Bahamas with air bubbles, the bends, diving issues, decompression sickness. I think about that. And then I think about traditional hospital settings, burn units, wound care units, where we see hyperbaric treated for crush injuries, carbon monoxide, burns, gas gangrene, sudden hearing loss, infections of the bone or the skin, and osteomyelitis. We see it in radiation injury of patients who are receiving radiation for cancer. We can use hyperbaric on them and affect great benefits. In addition to this, we can see it with sudden retinal occlusion, retinal artery occlusion, and vision loss. And lastly, the traditional thought that a lot of you doctors that are on here have, which is wound care. Now, what you need to know about wound care is only 5%. That's right, 5% of all wounds qualify to be able to treat with hyperbaric oxygen. It's a very high standard. So not all wounds get hyperbaric oxygen, even though I think most wounds would benefit from it. And that's because Medicare does not pay for things that are not FDA approved indications. And that's really what we're talking about here. FDA indications that have been studied and have been lobbied for and have been approved. Now, there are a whole bunch of other off-label uses of hyperbaric oxygen. So before I talk about the types of things that we use hyperbaric oxygen for, I want to talk about off-label use. As I've said before, the FDA does not regulate the practice of medicine. The FDA regulates what you put in your body and how you put it in your body. It's very important. I can tell you right now, I myself, use dozens of medications off-label. If you've ever been prescribed gabapentin for pain, that, my friend, is an off-label use. Yet today, the CDC and the FDA and the American Society of Addiction Medicine and the pain medicine specialists advocate gabapentin for neuropathic pain. They are advocating, the societies are advocating off-label use of a medication. And I can tell you right now, there is a lot of off-label use going on, safely in the United States under medical supervision. Now, what's amazing about hyperbaric oxygen is there are a tremendous amount of off-label indications that are internationally recognized. Just because our FDA in the United States does not approve them does not mean we do not have therapeutic effect. From musculoskeletal injuries, like my professional athletes and my high school athletes, yes, hyperbaric oxygen can be used for adolescents and children with high effect, or neurologic conditions, traumatic brain injury. As I said, Medicare will not pay for traumatic brain injury because it is not technically an FDA indication, but TRICARE will pay for this. It's very important to understand. A lot of doctors in hyperbaric medicine are using nationally and internationally recognized indications that are off-label. Other ones include long COVID. The work of Alan Katz and Sandy Wainwright, who I know exceedingly well, have shown benefits in long COVID. Also, the work of Shaya Frati and the team in Tel Aviv have shown amazing benefits with long COVID. We also have seen studies for Lyme disease, for fibromyalgia, for rheumatoid arthritis. In addition to that, we know plastic surgeons avidly are using hyperbaric oxygen off-label to help with compromised wounds, to help with plastic surgery recovery. We know that you have a better healing effect with intermittent hyperoxia from hyperbaric oxygen. And lastly, I want to talk about longevity, aging, brain fog, mental clarity. The work done at the Aviv clinics and the research done in Tel Aviv have demonstrated that hyperbaric oxygen could be the next best thing since the cocoons in Wilford Brimley's Cocoon. That's right. We see an improvement in telomeres. We see an improvement in stem cells. We see an improvement in epigenetic markers. These are all signs of aging, aging that we previously thought was unable to be halted. Dead wrong. Hyperbaric oxygen is changing the rules on all of that. So let's talk a little bit about sports medicine. I myself am a regenerative medicine doctor, a longevity doctor that does a lot of sports medicine work. What do? I use orthobiologics. What are those? I use your own bone marrow concentrate, where we have what are called mesenchymal stem cells, or mesenchymal signaling cells, or medicinal signaling cells from your bone marrow. I also use it from your own fat. We have a lot of these cells in our own fat. In addition to that, I use platelet-rich plasma to inject into the sites of injury. It's amazing, but it's a procedure. And in fact, with that procedure, I augment it with hyperbaric oxygen. Why? We know that hyperbaric oxygen accelerates healing. And in fact, one of the things we've seen, it has a great benefit in hamstring healing. This is going to be important as we go into football season. Football and soccer and swimming and track, you may not be able to afford a large amount of regenerative medicine orthobiologics. We have found that hyperbaric oxygen reduces grade 1 hamstring injury time recovery, and grade 2 time is reduced by almost 50%, 45% reduction. Now, how many people don't want to have ACL problems? I do. I don't want ACL problems. But we have found that post-reconstruction, hyperbaric oxygen leads to improved graft maturity. And we see that. And I can tell you, I think about quarterbacks who've gone down with Achilles tears. And in fact, you can use PRP, you can use stem cells, but hyperbaric oxygen improves the biomechanical properties to the Achilles tendon to prevent tears. And we know that there's some really great data on that. So in my world, prevention, an ounce of prevention is worth a pound of cure. So the goal here is to prevent the injury. Now let's talk a little bit about chronic conditions. So when we look at chronic conditions, I think personally about Lyme disease, rheumatoid, fibromyalgia, and now the scourge known as long COVID. We have strong evidence that long COVID and brain fog, and we'll talk about the neuro indications in a second, can be greatly addressed with hyperbaric oxygen, and I've seen it myself. In addition to that, we know that the pain points in fibromyalgia are greatly reduced with hyperbaric oxygen. In addition to that, chronic inflammatory conditions are ameliorated with hyperbaric oxygen because it's teaching our own immune system to respond properly. It's waking our cells up and it's fixing our immune cells. Now let's talk a little bit about hyperbaric for neurologic issues, because I think this is so important. I myself, and many people don't know, I'm a survivor of a stroke. I had a stroke post-COVID. Would you know that? With my hands waving around, you probably wouldn't be able to tell that. Well, I was a beneficiary of regenerative medicine and energy-based therapies. What we know about hyperbaric oxygen is it improves stroke healing. In addition, we know that it improves tissue oxygenation. Hyperbaric oxygen, just a few years ago, was shown to enhance neuroplasticity. And as I said about the team in Aviv, they use SPECT scans and functional MRIs to identify the following. Your brain learns quicker with hyperbaric oxygen. Your brain neurodegeneration is slowed down with hyperbaric oxygen. Your blood flow in your brain is improved with hyperbaric oxygen. Because of that, we can see improvement in post-concussion syndrome scores. We can see improvement in traumatic brain injury. We can see improvement in the neurocognitive deficits of patients who've had traumatic brain injury or post-concussive syndromes. And this is probably one of the most important parts of hyperbaric oxygen, being able to reduce the scourge of dementia, whether it's through CTE or whether it's through neurodegeneration. Hyperbaric oxygen holds immense promise to defeat the huge wave of dementia that we have coming in the United States. Now, I talked a little bit about the post-surgical things that we find here with plastic surgeons, but it's not just plastic surgeons. We see orthopedic surgeons now getting on board. In fact, one of my colleagues, Dr. Martin O'Malley in New York City, is using hyperbaric oxygen for enhanced wound healing to improve bone formation in his patients post-surgically. In addition, high dose oxygen can often kill bacteria. That's right. No need to poison your gut full of antibiotics when you can use oxygen to deliver that bactericidal effect. And as I said before, if you've had plastic surgery and you're recovering and you're not happy with your recovery, hyperbaric oxygen has been demonstrated to improve in 2015, in 2020, in 2023, in 2022, and again this year, studies have shown reduced scar formation, accelerated recovery, and enhanced graft and flap survival, which we know is very, very important with plastic surgery. So lastly, and last but not least, I want to talk a little bit about the future of medicine. So I am a longevity doctor. What does that mean? I want you to have a life well lived. That is a life where you can be free of disease. I would like to detect disease before it becomes disease. And one of the ways we do that is through longevity medicine. Identifying problems in your cells, such as shortened or shrunk telomeres, a sign of aging. We want to be able to defeat that sign of aging, that hallmark of aging, by improving your telomeres. Now, the Amir Hadani, Shai Efrati, and his team in Tel Aviv have demonstrated and replicated that hyperbaric oxygen improves your telomere length. What does increased telomere length do? It improves your cell activity. It prevents your cells from becoming senescent. What are senescent cells? Think about senescent cells like your college-age graduated son coming back and living in your basement. Now that son is not going out and getting a job. Instead, he's playing games, video games in his room all day. And he's calling up to you, hey, Ma, hey, Pa, can I get a sandwich? And he does this all day long, pulling your resources and energy away. That is cellular senescence. And what's even worse is that your son calls his buddies over and they're now down in your basement asking for you to order Jimmy John's or Jersey Mike's or whatever for a pizza for the whole team. Well, guess what? You had to go run errands. You had to go take care of the house. You had to go do important things like work. But you cannot do that because you are feeding your senescent son. Hyperbaric oxygen kicks your son out of the house and gets him a job, and he starts paying you back. That is what's going on here with hyperbaric oxygen. Improving telomere length reduces senescent sons and puts them to work for you. In addition to this, we see hyperbaric oxygen helping with skin health. Now, there's a big craze in the anti-aging world about medications like rapamycin. Why? Because rapamycin helps reduce cellular senescence and senescent sons. It helps your skin cells glow and rejuvenate. We see it in creams, we see it in injections, we see it in the pills. Well, I'm here to tell you right now, if you don't want to take pills and don't want to spend a lot of money on creams, we have data just from this year and in the past as well for hyperbaric oxygen enhancing the immune system's ability to eliminate aging changes in your skin. Hyperbaric oxygen is for aesthetics, but I wouldn't have my esthetician use hyperbaric oxygen on me. I would go to the doctor. In addition to this, I talked about the neurologic benefits of hyperbaric oxygen. Just this year, there are studies underway evaluating hyperbaric oxygen for attention deficit disorder, which I know there are a big hullabaloo about putting patients on attention deficit medications, which has been rampant for years and has helped quite a bit of children. The problem is the long-term effects of stimulants for ADHD now include cardiac damage. Hyperbaric oxygen does the exact opposite of that damage, and its ability to enhance cognitive performance and blood flow has been demonstrated throughout the 2020s. So it really is now a golden age of hyperbaric oxygen. We are about to revolutionize longevity medicine through the effective use of medically delivered hyperbaric oxygen therapy. No longer is hyperbaric oxygen just for diabetic wounds and skin burns. It is for the future. So how can you refer someone? I know there's doctors on here that are interested in how to refer someone. Well, I want to tell you what you need to look for before you refer a patient. And if you are a patient on here right now, pay close attention to this before you pay your hard-earned money to someone who is a magical hyperbaric chamber that's nice and soft and squishy. The first thing you need to look for is trained and/or certified staff. The Underwater and Hyperbaric Medical Society, as well as the IBUM or other authorities, certify trainees for hyperbaric medical technicians, as well as hyperbaric physicians. The training is rigorous. This is not something that you can do in a day and click through a bunch of slides and put it up as a certificate for you. It is much longer than that. So you need to search for a place that has UHMS trained staff. In addition to this, you need to make sure that there are patient-specific protocols. One of the big problems I have with hyperbaric oxygen is not writing the script. Can you imagine if the doctor looked at you and said, give him combo number 5? That's not what happens in medicine, and that's not appropriate care. What's appropriate care is personalized medical prescriptive treatment programs for you, not for Joe Blow down the street, for you. And it's important that you ask, will I get a patient-specific protocol? Yes or no? Is that patient-specific protocol, does it have evidence? Yes or no? If they can't answer you, or they can't show you some of the literature with the evidence, you need to run away. Secondly, you need to make sure that the chamber that you're using is certified and compliant. As I said before, we are increasing the pressure in a closed space. There are lots of risks with that if those chambers are not FDA approved and certified by ASME. In fact, many of you may not even know whether a chamber has been inspected or not if you're in a med spa. But if you're in a medical facility with medical oversight, the first thing you can ask for is this chamber FDA approved? Is it ASME certified? If they cannot produce this for you, say, doctor, thank you very much. I'm going to go about my business. Why? Cutting corners with hyperbaric oxygen will give you more risk than benefit. And everything in medicine is a risk-benefit evaluation. So why take the risk if you're not going to get the benefit? Medical oversight with trained staff using patient-specific protocols in a certified chamber is truly the only way to go to heal smarter with hyperbaric oxygen. So now I want to turn it back over to you, Chris, and see what questions that we have.
Well, thank you so much, Dr. Murphy. That was incredible. I'm sure we could spend many more webinars continuing to deep dive in, and we will. So if anybody has a question, we've had a couple come in, but if anybody else has a question, use the Q&A chat function, and we can bring your question up to respond. The first question that we had come in, Dr. Murphy, what are some of the big misconceptions about hyperbaric? And you talked a lot about chambers and what maybe physicians believe hyperbaric is to be used for traditionally with wound care. What are some of the other big misconceptions that you've seen or heard about with hyperbaric that you'd like to address?
Oh, sure. I think one of the biggest ones is that I'm not going to be able to communicate with the outside, and I'm going to be trapped in this chamber. There's a big, scary misconception about that, whether it's patients or whether it's physicians. Patients with anxiety, patients with claustrophobia. Believe it or not, there is adequate communication with a chamber. There are chambers that use sound-based phones. There are radio-based scenarios. There's a whole host of ways to communicate in the chamber, number one. And number two, there are protocols to help patients with anxiety, very similar to what we have with an MRI. When someone thinks of a hyperbaric chamber, they think of the bends, and they think of someone being in a chamber for 5 hours at a time. Traditional treatments and the newer treatments for longevity and the other off-label uses often result in you being in the chamber far less than that, about the time of an MRI. So I think that's a big misconception that people have, outside of the whole traditional misconception of it's only for diabetics with non-healing wounds. Nothing could be further from the truth.
Yeah, no, that's great. I think that is a prominent, in our experience at least, it's a prominent concern for patients, that they won't be able to communicate, or they won't have any sense of control, and it couldn't be further from the truth, like you mentioned, especially when done in the right setting with all those other attributes that you brought up before. We have one other question here about integrating hyperbaric with other treatments, like other regenerative medicine treatments. You kind of talked about this before, and it might, I think, be spot on with your background. Tell us a little bit about what other treatments hyperbaric is synergistic with, especially for different purposes like healing and recovery.
I think it's so important. You highlight a really great point. I have seen the benefits of cellular orthobiologics like PRP, like stem cells, and I won't call them stem cells because someone might get mad at that, but they really are stem cells. and they benefit from pre-treatment harvesting, right? Using hyperbaric oxygen to release more stem cells that you can take from your body, number one. Number two, you can enhance your stem cells and make them healthier using hyperbaric oxygen before your treatment. And what's amazing is after that's done, you can use hyperbaric again to help heal your rotator cuff, to help heal your hamstring, to help reawaken your senescent cells in your cartilage. So I think for orthobiologics, it's a no-brainer. And I know personally multiple doctors now actively getting into hyperbaric therapy to improve their outcomes in their professional athletes that they're giving regenerative medicine to. And I know for patients with sports injuries, especially our young kids, we don't want them to have surgery. So if you can avoid that by maximizing their healing with hyperbaric oxygen and cellular therapies, it's amazing. In addition to that, one more thing, Chris, I want to talk about.
Yep.
And that is stroke recovery. Using energy modalities like near infrared light at 1070 nanometers, alternating with hyperbaric therapy, together, like chocolate and peanut butter, has been shown to truly enhance outcomes and recovery and neuronal plasticity. We have seen that in animal studies. We're seeing it being proven in the real work of the clinic down at a place like the team at Aviv that's in Orlando or in Dubai. It is crystal clear that if you are recovering from a stroke and you're not using hyperbaric oxygen, you really are not maximizing your chance at brain recovery.
Yeah, no, that's well said. We had one other question just come in actually about, have you ever worked with a protocol combining medical ozone therapy to obtain or increase all full potential of both therapies at a cellular level?
Right.
So,
And I think this is a great question. You know, ozone therapy has been shown to help in orthobiologics. It has been shown to help in arthritis. It has been shown to help in a whole host of conditions. There are a lot of conditions where EBU, right, which is an extracorporeal infusion of ozone, has had case report help. No big randomized double-blind control studies. That's a shame, because we know that ozone, in addition to hyperbaric oxygen, enables you to generate what is called radical oxidative species, therefore improving your mitochondria's ability to fend off and fight against natural events that bombard us every day, from radiation to microplastics to a whole host of chemicals that are creating free radicals in our body. There are, as I know right now, 2 different studies nationwide investigating exactly what you're talking about. And so I look forward to those publications so I can really dig my teeth into this. It is not that I'm willing to not try things that don't have evidence, but it is always a risk-benefit sliding scale. And so I think it's very important that if you're going to place a patient at risk, you have to maximize your benefit. I do think there is immense potential for combining ozone and hyperbaric. The data continues to evolve, and we also are actively investigating what you're suggesting.
awesome. Well, thank you so much, Dr. Murphy, for your time today. Thank you for your generosity in depositing your knowledge and your passion for hyperbaric oxygen therapy to our listeners. And certainly, I've learned quite a bit as well. We encourage everybody to continue to engage in research and webinars like this to be informed, whether you're a patient or a provider. If you have any questions specifically, you can email Dr. Murphy. It can be reached through stanford@mdhyperbaric.com. And we're happy to continue to engage in conversation. Follow us at MD Hyperbaric on LinkedIn, or for Dr. Murphy's business, Concierge Medical Associates, where he is a very avid and engaged user, publishing research and at the forefront of emerging technologies. So thank you again for your time and participates. And Dr. Murphy, we really appreciate your wisdom here.
Thanks for inviting me, Chris, and good luck to everybody out there. Remember the tips that I gave. Hyperbaric oxygen has tremendous potential to heal if done right. And frankly, it's not done right at a MediSpa. So find a provider that is certified.
All right. Thank you, everyone.